ResMed, global leader in sleep-disordered breathing, now brings you Narval, an innovative device indicated for mild to moderate OSA and snoring. Thank you for deciding to offer your customers and their patients the Narval CC, the first CAD/CAM MRD solution on the market. The Narval device is custom-made to your customer's prescription and the needs of their patient. If at any time the device does not fit the patient perfectly, minor adjustments can be made, either in the dentist's chair or by the laboratory. If the device is returned, please ensure the dentist's instructions are clear. If the retention is too weak, heat the side of the splint with insufficient retention with a gas heater. Deform the splint by bringing the sides of the splint together with finger strength. Apply force to the edges of the splint. Cool completely with compressed air to maintain the applied strain. Place the splint on the plaster impression and test the changes. If retention is still insufficient, proceed the same way on the other side. Test the clip of the splint on the plaster impression. For excessive retention, use the scalpel in small retouches to remove the material inside the splint in areas with too much retention. If the retention is still excessive, proceed the same way using a diamond burr. If the excessive retention persists, briefly reheat with the gas heater. Place the softened splint carefully and promptly on the plaster models. Remove areas where the plastic has been compressed and distorted. Retest the clipping of the splint on the plaster models. If the advancement or deviation is causing the patient some discomfort, this can be adjusted using different size connector rods. Posterior contact can occur at the ends of the advancement plane. Use a small burr to remove the contact point, then polish the surface. Connector rods are designed to stretch if the patient is a very strong bruxer. They can be simply replaced. If a device shows signs of cracking, then it must be remade. Despite the range of possible alterations in the service laboratory, some cases require a remake because the adjustment can only be performed by the computer-aided design CAD software.